Welcome back, everybody. Doctors are warning people who have underlying medical conditions or a weakened immune system, they're at a higher risk of complications if they can contract COVID-19. ABC4's medical correspondent Saray Chin talked with Intermountain Healthcare about that earlier today.
How to stay safe if you are immunocompromised during COVID-19. We have Dr. Timothy Yateman with Intermountain Healthcare. Thank you so much for joining us.
You're welcome. Good morning.
Good morning. Dr. Yateman, these are people at high risk. We are worried about them. Tell me who these people are.
Well, immunocompromised people can fall into a number of categories. They can be, frankly, just older individuals, patients that have lung disease, diabetes, kidney disease, HIV, people with cancer, various forms of cancer, pregnant women, also patients that have undergone a transplant, a kidney transplant, a liver transplant, people with rheumatoid arthritis, multiple sclerosis, Crohn's disease, lupus, psoriasis. So there's a whole class of folks that could be immunocompromised. And one great example is the older adults, because in fact, we know that when older adults get the flu shot, they require a higher dose of the flu shot to stimulate their immune system because it doesn't work as well as a younger person.
There are some 109,000 patients with Intermountain Healthcare who fall under this category. The main message, though, some of them take immunosuppressive drugs, and the first thing they may say is, let me stop taking that. But the number one thing is, do not stop taking those particular medications, correct?
Right, and in most circumstances, that's correct. And before anyone should change their medications, they should always check with their doctor. Make a phone call to the doctor. You don't have to do a visit, and usually you'll get an answer. Certainly for transplant patients and patients that really rely on their medications, absolutely don't stop them until you've spoken with your physician.
This is so important to highlight because people might make a knee-jerk reaction because there's so much uncertainty right now. But the message is, please talk to your doctor first.
That's correct, and this group of patients should take extra care, obviously for social distancing, washing their hands, really staying at home as much as possible because they are at greater risk.
Is there anything else that they should take in particular protection in these people under this category?
I think the safest thing is to stay at home as much as possible. You know, certain states have shelter-in-place orders now and want everybody to stay at home unless they're essential healthcare workers or need to go out for an occasional grocery run. But for the most part, I think these patients in particular should stay at home.
And we can always have either loved ones or someone else deliver those groceries at their doorstep, taking those extra steps to keep everyone safe. There is, Dr. Timothy, a hotline, a COVID-19 hotline that you have put up. It is 844-442-5224. Dr. Yateman, any last advice for these patients?
Now, I think if everyone takes this extra measure, watches out for themselves and for their neighbors and their friends, we'll get through this.
I love that message. Dr. Yateman, thank you so much from Intermountain Healthcare. Also, visit their website, intermountainhealthcare.org. We're going to have a link on our website, abc4.com. Thank you, Dr. Yateman.
Thank you.